How's your pain today?
Melanie Simpson is blazing a trail as she talks with patients about managing their pain. She coordinates the only nurse-led pain management team in the Kansas City metro area, and there's only a handful of nurse-led pain teams nationwide. To her, being nurse-led makes perfect sense. As pain is the one thing nearly every hospital patient shares, nurses are on the front lines managing it, and controlling pain is critical to recovery. It's that attitude that led to her being named a National Magnet Nurse of the Year.
Patients don't take deep breaths, they don't get up and sit in a chair, they don't do the things that they have to in order to get better if they hurt. They just can't. And so the sooner we get them more comfortable, it's all about getting them up and being able to do the things they need to so they can get out of here.
When she's not at a patient's side, she's teaching nurses, residents, anyone who will listen about the importance of managing pain and how unique the program is that started here at the University of Kansas Hospital in 2001. As word spreads about our program, so do requests from nurses and other hospitals to come and shadow Melanie and her team.
We'll never know the number of patients that she's impacted. We can see it every day in our hospital, and we know that both through the work that she does and the work of the team that she has, I think we know that our patients' pain is better controlled, but I think that she's also impacting patients across the country because she's teaching nurses from Kansas City and from West Virginia and from Oklahoma and a number of other places, and she does that on a regular basis.
Pain itself is a very complex entity. Melanie is able to kind of synthesize all these things that kind of come together, and her and her team play an amazing role of how do you address the pain patients and their needs. And so she's able to kind of cross the multidisciplinary lines, pulling the anesthesia folks, pulling the surgery folks, pulling the medicine folks, pulling everyone, and say what's best for this patient.
Melanie believes the subject of pain and pain management should be a national priority, and she's doing her part advocating for patients, teaching, even talking with the media.
It's extremely fulfilling. People say, oh, I don't know how you do that all the time. But, when you make patients comfortable, you go back the next day and they are so happy to see you. Patients are when they're comfortable, they're more satisfied and they're much more happy, as is their family, the nurses taking care of them, the physicians. It's truly a win-win for everybody when we get patients more comfortable.
For the University of Kansas Hospital, I'm Jill Chadwick.